So if you're watching this, you've probably just had your healthy heart check or had your cholesterol checked, and the team has suggested that you may benefit from starting a statin. You might be thinking, well, why me? I feel fine. What even is a statin? Well, you're not alone in asking these questions. So let's break this down together and I'll show you why this could be one of the simplest, most powerful steps you can do to protect your own health. So what are statins? Statins are medicines that lower the bad cholesterol, which are fatty deposits in your blood. Why does this really matter? Well, let's picture your arteries, which are blood vessels that carry blood around the body as pipes. Over time, these fatty deposits can start to build up and stick to the walls of these pipes. This build-up makes the space inside narrower and stiffer, which increases the risk of blockage. And blockage in the wrong place can cause a heart attack or even a stroke. Statins slow that down and keep the pipes clearer for longer. This means better blood flow to healthier organs and, most importantly, decrease the risk of heart attacks and strokes. Fortunately, they're not a quick overnight fix, they're a long-term protector. If you'd like more information in detail, I'm going to leave a link below to the NHS guidance on statins. So what is QRISK? Now you might be wondering, why do I need a statin all of a sudden? You may have also heard us talking about QRISK. So this is a special calculator we use to estimate your risk of having a heart stroke in the next 10 years. If your score is more than 10%, meaning that 1 in 10 people like you will have a heart attack or a stroke in 10 years, then you're recommended for a statin. QRISK takes into account many factors and we can split them up into like preventable and unpreventable. Preventable factors are things that you can change, such as smoking, diet, weight, blood pressure, cholesterol, and how active you are. The unpreventable factors are things you can't change, like your age, sex, and ethnicity, and your family history. And here's the kicker, even if you live a really healthy lifestyle, your QRISK score can creep up over time simply because you get older, and age is one of the biggest risk factors. But we can reduce risk factor. And how do we bring that down? So there are two main ways, lifestyle and medication. Lifestyle is the foundation reducing your preventable factors. And we explained before, such as quitting smoking, eating more vegetables and fibre, exercising regularly, and trying to keep your cholesterol and weight and blood pressure down. These changes can make a huge difference by themselves, but sometimes lifestyle changes alone just, unfortunately, not enough. That's where early prevention with statins can come in. Give you that extra level of protection by cutting your risk of heart attack or a stroke by about 25 to 30%, and that's a huge deal, especially if you want to stay healthy that way. Combining statins with healthy habits is the best way of giving you a chance to avoid serious problems. If you'd like more information on reducing cholesterol, I'll leave a link below between the British Heart Foundation resources. Go into a deep dive into how to reduce your cholesterol. So local guidance. At our practice, we use something called the NEELI guidelines, and that stands for North England Evaluation and Lipid Intensification. These are local evidence-based standards and they're used to make sure everyone gets the safest and most effective cholesterol treatment. NEELI sets clear cholesterol targets. If you don't reach these specific targets on a standard dose of statin within the first 3 months, we may want to try and boost the dose or try another medication. If you'd like to take a deeper dive into these guidance and specific targets, again, I'm going to leave the link below. Myths. Myths. Now let's tackle the elephant in the room, the scary side of statins. You may have heard stories of them causing terrible side effects, such as damaging your liver. And here's the truth. 90% of people who take statins experience no problems at all. Very serious side effects are extremely rare. Mild muscle aches occur in about 5% of people, and if that happens to you, you can let us know. You'll normally be started on atorvastatin, and your doctor switch you over to some other statin, such as rosuvastatin. You can be switched to a different medication entirely called ezetimibe as well, if either of those don't work. Remember, we don't just give you a prescription and wave you off. We'll do blood tests at the start, then again at 3 months and 12 months, just to make sure your liver is happy and your cholesterol levels are improving. So why start now? Taking a statin isn't about treating illness, it's about preventing it. It's like wearing a seatbelt. You don't just put it on because you expect to crash, but because you want the protection in case one happens. The sooner you start, the longer you give your arteries protection. In fact, long-term adherence can add 5 to 10 extra years free from cardiovascular disease, depending on your risk profile. Also, you'll get more years of healthy life you get to enjoy. So, if you've been recommended a statin, it's not because you're sick. It certainly isn't bad news. It's because we want to keep you healthy. In the UK, statins are estimated to prevent tens of thousands of heart attacks and strokes every year. And will you join the millions of people who've already reduced their risk of serious heart problems? Combine it with healthy lifestyle changes and you're stacking the odds in your favour. Remember, prevention is always better than your cure, and your future self will thank you in advance. Thanks for watching. If this has helped, please share it around. Someone who's been asked to start on a statin as well. If you want more information, you'll get some options within the text message, and you can book a face-to-face appointment or over the phone, depending on how you wish. With regards to this message as well, if you think I've got enough information, I want to start a statin, just respond to it and we'll get you sorted accordingly. Dr. Dave Highmarsh, Eaglescliffe Medical Practice, and stay protected.